In the journey of understanding the human body, today we dive into the topic of hepatitis. This term refers to an inflammation of the liver, a condition that can be a result of various factors. However, the most common culprits are the hepatitis viruses. These microscopic invaders come in 5 different strains: hepatitis A, B, C, D, and E. Each strain is unique, carrying its own set of characteristics and modes of transmission. For instance, some are transmitted through contaminated food and water, while others can be spread through blood or other body fluids. It's important to note that hepatitis isn't a condition to be taken lightly. It's not just a simple inflammation. It's a complex disease that can lead to serious health complications if not addressed promptly. Now that we have a basic understanding of what hepatitis is, let's delve deeper into the symptoms. While hepatitis may seem like a silent invader, it does leave signs and symptoms. Let's delve into the realm of symptoms. You see, the symptoms of hepatitis can vary dramatically depending on whether the infection is acute or chronic. Now, what does that mean? Well, an acute hepatitis infection is a short-term illness that occurs within the first 6 months after someone is exposed to the hepatitis virus. This form of hepatitis can prompt more severe symptoms in the short term. These might include jaundice, which is a yellowing of the skin and eyes, severe fatigue, and sudden nausea and vomiting. Acute symptoms may also feature a fever, abdominal pain, or even dark urine. On the other hand, a chronic hepatitis infection is a long-term illness that occurs when the virus remains in a person's body. This type of hepatitis can lead to long-term complications such as liver damage, cirrhosis, liver failure, and liver cancer. But here's the tricky part. Chronic hepatitis may not show any symptoms until the liver damage is significant. Regardless of whether hepatitis is acute or chronic, some common symptoms are prevalent across all types. These include fatigue so intense that it disrupts daily activities, a sudden loss of appetite, and jaundice, as we mentioned before. Other symptoms might be less noticeable, like mild flu-like symptoms, aches and pains in the joints and muscles, and itchy skin. Remember, these symptoms can be easily mistaken for other conditions, or even be dismissed as just feeling under the weather. So, it's crucial to pay attention to what your body is telling you. If you're experiencing any of these symptoms, particularly if they persist or are severe, seek medical advice promptly. Symptoms could be subtle or severe, but the key is to identify them early. It's all about keeping a vigilant eye on your health. After all, the earlier the detection, the better the chances for successful treatment. Prevention, they say, is better than cure. In the case of hepatitis, it holds true. The risk factors for hepatitis are many, but the good news is that they can be managed and even better prevented. Firstly, let's talk about unsafe drinking water. Hepatitis A and E are transmitted through contaminated food and water, making access to clean water essential. Developing countries are more at risk due to insufficient sanitation and hygiene practices. Then we have the lack of vaccines. Vaccines are our first line of defense against hepatitis. Not being vaccinated against hepatitis A, B, or E significantly increases your chances of contracting these viruses. Now, let's delve into certain behaviors that put you at risk. Unprotected sex and drug use, particularly sharing needles, are major contributors to the spread of hepatitis B and C. These behaviors expose individuals directly to the virus, making transmission almost certain without precautions. So how do we prevent hepatitis? Vaccinations, screenings, and practicing safe behaviors are key. Vaccinations provide immunity against hepatitis A, B, and E. Regular screenings, especially for those at high risk, can catch the disease early, leading to better outcomes. Practicing safe behaviors, such as using condoms during sex and not sharing needles, can greatly reduce the risk of transmission. Moreover, simple steps like washing hands regularly, especially before handling food, can prevent the spread of hepatitis A and E. It's also crucial to ensure the safety of your drinking water, particularly when traveling to areas with poor sanitation. Prevention is a proactive approach. It requires awareness and a commitment to safeguarding your health. It's about making smart choices, like getting vaccinated, practicing safe sex, and maintaining good hygiene. As we navigate through life, we must remember that our health and safety are in our hands. Each decision we make, each action we take, has the potential to protect us or put us at risk. Remember, your safety is in your hands. Make wise decisions. Diagnosis and treatment of hepatitis are pivotal steps towards recovery. When it comes to diagnosis, it's a multi-pronged approach. It starts with understanding your medical history. Doctors will delve into your past health records, looking for any patterns or past incidents that may indicate hepatitis. This could include previous illnesses, lifestyle habits, or travel history. Next, physical examinations come into play. Your doctor will check for any signs of liver disease, such as an enlarged liver, tenderness in the area, or yellowing of the skin and eyes, also known as jaundice. But it doesn't stop there. Various tests are utilized to confirm this diagnosis. These can include blood tests to detect viral antibodies, liver function tests to assess the health of your liver, and imaging tests to visualize the liver's condition. Once diagnosed, it's time for treatment, and it's not a one-size-fits-all approach. Depending on the type and stage of hepatitis, treatment can include antiviral medications to fight off the virus and prevent further liver damage. But medication alone won't do the trick. Rest is essential to give your body the energy it needs to heal. And let's not forget lifestyle changes. This can mean avoiding alcohol to prevent further liver damage, eating a balanced diet to boost your immune system, or even getting regular exercise to improve your overall health. It's about creating an environment in your body that is hostile to the disease and conducive to healing. But remember, all these steps towards diagnosis and treatment are only as effective as they are timely. The importance of early diagnosis and treatment cannot be overstated. The sooner you catch hepatitis, the better your chances of managing the disease and mitigating its effects. It's like catching a thief in the act rather than after they've left the scene. Early diagnosis and treatment are not just words, they are your shield against this disease. The battle against hepatitis is fought in the doctor's office, in the lab, and within your own body. And like any battle, the sooner you suit up and strategize, the better your chances of victory. As we march ahead, the fight against hepatitis continues with fervor in the scientific community. The relentless pursuit of knowledge is as apparent as ever, with an array of ongoing research projects aimed at enriching our understanding and management of this formidable foe. Researchers are unearthing the intricate mechanisms that these viruses employ to assault our bodies, dissecting their strategies down to the molecular level. This deeper understanding is expected to pave the way for more effective treatments. There is a concerted effort to develop antiviral medications with fewer side effects and greater efficacy, and to enhance the effectiveness of existing therapies by fine-tuning their application. Beyond treatment, the ultimate goal remains finding a complete cure for hepatitis. While this may seem like a daunting task, the scientific community is optimistic. The rapid strides we've made in the past few decades serve as a testament to our capacity for innovation and discovery. While the battle against hepatitis rages on, our understanding and treatments are ever evolving. As we conclude this insightful journey into the world of hepatitis, we have a crucial message for you. It's not uncommon to feel uncertain or even scared when it comes to diseases like hepatitis, but it's important to remember that knowledge is power. If you suspect that you might be experiencing the symptoms we've discussed, don't hesitate to seek medical advice. It's better to be safe than sorry. Early diagnosis and treatment can make a world of difference. The sooner hepatitis is detected, the sooner a treatment plan can be put into action. This can help reduce the risk of long-term complications like cirrhosis, liver failure, and even liver cancer. Remember, there is no shame in seeking help. It's not a sign of weakness, but rather a sign of strength. It's about taking control of your health and well-being. And while medical professionals are there to guide and support you, don't forget that you too play an essential role. You are your own best advocate. You know your body better than anyone else. Listen to your body, seek help when needed, and remember, you are your best advocate in the battle against hepatitis.